Thank you, Mr. Chairman, and thank you to our panel today on this very important issue regarding SGR. Dr. Hackbarth, I have a question in relation to some of the situations with the 2014 CMS changes that are coming with the physician fee schedule. June 2013, MedPAC reported to Congress, and quote, if the same service can be safely provided in a different setting, a prudent purchaser should not pay more for that service in one setting than in another. And then it goes on to discuss some of the payment variations. But in the 2014 CMS Medicare fee schedule, it seems to be doing the exact opposite. Can you expand on that and explain the thinking behind that?
Mrs. Ellmers, is there a particular example in the CMS proposed rule that you're?
I'm particularly concerned with oncology services, but certainly any of the outpatient services that can be provided in a hospital or outside of, in an outpatient setting or ambulatory care, the difference.
Yeah, so you correctly stated what our principle is, which is that we shouldn't pay higher rates for hospitals if the same service can be safely provided in lower cost settings. And we are in the process of making recommendations to the Congress to move Medicare policy in that direction. We made a recommendation about evaluation and management services a couple years ago. At this upcoming meeting next week, we're looking at an additional batch of services, many cardiology services, for example. CMS doesn't always agree with our perspective on issues, and this is an example where I think there have been some differences of opinion.
Okay, and two, I cited oncology services and some of the outpatient services, but I'm also, concerned about reimbursement for some of the Medicare therapy services. Now, earlier, and I actually kind of crossed this off my list because I think you really referred to those changes coming more in the accountable care organizations. Is that true as far as the therapy cap issue?
So what we've recommended on outpatient therapy, we don't believe that there should be hard caps imposed on therapy services. That said, we do think that after some point, additional services should be subject to review before they occur, which is an approach very similar to what private insurers typically use on outpatient therapy.
Okay. And just lastly, and this is really more of a comment and a question for you as well. I continue to be concerned about the physician reimbursement in relation to Part B payments through hospitals or Part A payments through hospitals with the upcoming CMS changes. I'm afraid that with the trend that's moving forward, that this is going to affect the viability of Medicare to our seniors. And I just want to get your reassurance, if you can commit to continue to work with my office on making sure that MedPAC, that we work in conjunction to make sure that reimbursement is adequate.
To do that.
Thank you, sir, and I yield back the remainder of my time.